cut now.
Hi guys. We are back. Today we are talking to you about greater trochanteric pain syndrome.
Yep.
Right.
Can you kind of tell us the anatomy of the hip and where the pain is kind of localized? Is it at the top, is it at the bottom, is it in the middle?
So this is the pelvic bone, the big bone, and then the hip is actually over there, and the greater trochanter is that bone over there. So that's the bone that sticks out on the side of your hip here. And so with greater trochanteric pain syndrome, it's a bit of a generalized term for a few things that can go wrong, but basically it involves the glutes and the bursa.
Okay, so if we can kind of break down the glute muscles because there's a few of them.
Yes.
Just show us a little bit of
Right.
where they lie.
So you have three glute muscles, okay? You have the deepest one is the glute minimus, and then you have the glute the medius, that kind of goes over the glute min, and their attachment is onto the greater trochanter. Those are the stabilizers. And then we have the glute max, which you can see on this picture, and that's the butt muscle, okay? And that's more of a mover than it is a stabilizer.
Okay. So what is a bursa?
Bursa is basically just a sac of fluid. The muscle will go onto the bone, and then underneath the muscle, between the muscle and the bone, you get a bursa. And so that can get inflamed, which would then be a bursitis, and you will treat that a little bit differently than a glute tendinopathy, which is all falling under the sort of roof of greater trochanteric pain syndrome.
In short,
Yes.
what causes greater trochanteric pain?
So that's a bit of a loaded question because there's many things that can cause it, but I'm going to just go into two
The most common.
the most common stuff that we see
Yeah.
here. So one is trauma related. So you have a fall on your hip which causes bruising or damage to the glute, or it causes damage to the bursa. It can cause inflammation. And then most often what we see is it's related to an imbalance in the pelvis.
Okay.
So the pelvis and the hip is very closely related. So whatever happens in the hip will affect the pelvis, what happens in the pelvis will affect the hip because they are articulating with each other. So when we assess patients, we see that they have tight hip flexors, okay, which then changes the position of the pelvis basically, and it just causes the glutes to shut down, it causes the ITBs to get tight, and that causes more pressure on the side,
Yes.
over that greater trochanter.
So who typically gets this sort of pain in the hip?
So often women get it because of our wider Q angle, the way we are built. So naturally you have more tension over the greater trochanter. So that's one. Athletes, so when you have a bit of an imbalance and you do high impact sport, or you do high quantities, what aggravates it also is stair climbing. This motion basically where you flex and extend. That area would constantly be irritated.
Okay, and I know you said you usually get it in winter.
Yes.
So it's from laying in that fetal position.
Yes, and laying on your side. So it doesn't even have to be sport related, just that extra pressure of laying on your side all the time can aggravate the bursa. Yes. Obviously, if it's a tendinopathy, if it's a glute med tendinopathy, then we have to load the muscle isometrically and eccentrically. So it's a good idea to get a proper diagnosis from either your hip specialist or your sports physician, and that will also just give us a bit more information as to how to treat the patient.
Okay, so now that we've kind of gone through the anatomy and what it kind of is, we're going to have you go through some functional tests with Taylor, just to show you guys what we're kind of looking for in our assessment. And then this guy is our cervix. So this completely depends on what the patient presents with. If they're too sore, obviously we don't do it. If they can lie on their side as well, then it's a bit of a go ahead that we can do it. But mostly it's so that we can clear them and get them back to returning to sport and whatnot once they start to feel a lot better.
Yeah, and to make sure that the injury is actually healed, so we
And
so
the
they have
imbalances are
yes.
kind of corrected.
Yes, perfect. Okay, so once we figured out what needs to be worked on, we'll start working on that. And like we said, often it's an imbalance thing, so we'll work on creating balance in the pelvis, getting the hip flexors longer, getting the glutes firing properly, getting all the stabilizers working to stabilize that pelvis so that there's no rotation or tilt in the pelvis, and in that way offload the greater trochanter.
Greater trochanteric.
Greater trochanteric. Trochanteric. Tell me about